The University of Pretoria's community-oriented primary care research unit is leading the vaccination of undocumented communities against COVID-19 in Gauteng. The university has been working with international organizations, local NGOs, as well as religious institutions and government to ensure people who aren't documented are not left out. The program might be rolled out to other provinces. And for more on this, we're joined by Professor Debashis Basu, who's the head of Public Health Department at the University of Pretoria. Prof, good evening to you and thank you so much for your time. Why was it so important for the research unit to take up this cause of undocumented people?
Thank you, and thank you for inviting me, and good afternoon and Merry Christmas to all your listeners.
Thank you.
If you allow me, I wanted to start with a quotation from Archbishop Tutu. So what he said is, all my life, I've tried to do the right things. Today, getting vaccinated against COVID-19 is definitely the right things to do. That's why Leah, his wife, and I took this step to do our part, to start the national healing process so that we can end this pandemic. We have to do this together. The staunch supporter of vaccination said in a joint statement in his foundation and the Western Cape government release. And then he made a comment, like as usual, believe me, when you get to our age, little needles worry you far less than bending over does. So I think he is one of our strongest supporters, and we really lose somebody who is a guide, philosopher, and his foundation was always in the forefront, actually, of this vaccination drive. Having said that, I think this is an epidemic that it affects everybody. And our research unit is interested in that process, and not just the vaccination, but looking at the holistically as the health issues. Because vaccination alone cannot protect it unless we actually look into the whole health issues of these people. And as you are aware, that many of these people actually have no access to the healthcare because of various reasons. And so our research unit actually embarked on them because that's our main interest of looking at what we call the hard-to-reach community, whether they're homeless people, whether they're undocumented, whether they're substance users, and various other areas we can name them. So we not only look at just giving the vaccination, but we are interested of looking at this group of people who have not access to the healthcare, and vaccination is just one of them. So that is our philosophy in the research unit, to provide integrated care, and that's what the University of Pretoria have embarked on it for a while now.
And it's interesting that we have this conversation on a week when we're remembering the man you've just quoted there who fought for equality and access for all, and somebody who really fought for justice. But I'm really keen to find out from your, your research units, because as you say, you're calling them the hard-to-reach communities. I wonder what work goes into then making sure that you're able to reach them and find them, because, undocumented individuals often go unnoticed, when it comes to the system.
Absolutely. So this is where we started our work in Pretoria through our linkage to care with the various communities, the NGOs, church leaders, the religious organizations, the Organization for Homeless People. And we are very fortunate to have these organizations, as you mentioned initially, that the national and international organizations, and want to mention about MSF, who does commendable amount of work in this area. So to have the support from the community, I think it is very, very important to us to reach out to and getting the trust of these people, that we are not to catch them and report them to the Home Affairs. It is a very, very important issue.
Prof,
so we are quite...
pardon me, you can continue briefly, Prof.
No, please, go ahead.
Okay. Part of what we also see, Prof, is that when people are thinking undocumented, nationals, they're thinking people who are in the country illegally, but the list is broad, isn't it?
Absolutely. We found a lot of South African fellow South Africans who don't have an ID document, particularly those who are homeless people. We found people living below the bridge in Pretoria living on the streets. They don't have any ID document. And so our experience is not really that we are looking for the foreigners. A lot of our South African people don't have an ID document. On the contrary, we also find people, the foreigners, who may have an asylum seeker's paper or a passport which has expired. So in that sense, we have some documentations, and obviously a lot of them don't have it. So yes, so it is not just the foreigners. A lot of South Africans have a similar problem.
And Prof, when it comes to then at a practical level, you found somebody, they're undocumented, and you then want to provide some kind of care, health care to them. Talk to us at a practical level, what goes on then after you've put them into the program? Do they then go through some assessments and you then see what kind of health care they require?
So as I mentioned that, we work very closely with the Department of Health, particularly in the district setting like Swane or Ekurhuleni or Johannesburg. So when we start up any areas, and I will mention that we are moving to the other 5 provinces from January. So we communicate with the district health systems, and every person we vaccinate, whether they're documented or undocumented, we don't turn away anybody. We do a basic health check, and every person get a green book, which is called Linkage to Healthcare book, given by the Department of Health. And this booklet actually been used as their ID of the people who don't have a document. We record all their details, and many instances we found they have unmet health needs. And based on our relationship with the local government, which is the predominant service provider in the metro areas, we actually send them to the nearest clinic. And that are actually the reasons we take a long time to start the process, because we need that connections so that the people who have unmet health needs, we don't leave them, just give them a vaccine and say that you have diabetes and thank you. But we actually take care of them, we refer them to the clinic and ensure that they get taken care of. And please do remember what President Ramaphosa announced, that in near future, all of them will get their booster doses, whether they're getting the Pfizer or Johnson & Johnson, and we need to get them back. So it's not just a once-off event. So we have to develop that relationship, and that's what we do every time we go there.
And looking at the vaccination numbers that South Africa is really trying to boost and to go up to get more and more people vaccinated, this will certainly have an impact on getting the numbers increased on people who are vaccinated. How much of an impact will this have?
So far, we have vaccinated over 4,000 people. It's not a lot of numbers, but you do recall that these people are actually didn't get access to the healthcare for various reasons, whether they're daily wage earners, whether they don't have ID documents, so they couldn't reach out to the clinic, or they have health problems, which they were turned away from health facilities. And so the number might look small, but we don't chase the numbers. Our idea is to reach this community which we can achieve the targets. And many instances, I always tell my team, even if we vaccinate 5 people, is the 5 problem less? And that is the reasons actually we don't really chase the number, but we try to provide the best of the healthcare.
All right.
And we have seen in the hospital where I work in Steve Biko, there is a big difference between the vaccinated and the non-vaccinated people in terms of their outcome of the hospitalized patients.
All right. Thank you so much, Prof, for your time. That was Professor Debashis Basu. He's the head of the Department of Public Health at the University of Pretoria, talking about the importance of the undocumented communities, and they call them the hard-to-reach communities, to also get access to health care, not only around vaccination, but also around every other issue that they may require when it comes to health care. And he says this program is going to be rolled out to the 5 other provinces come next month.